Inflammation is a very important part of our immune system, and it's part of our innate immune system. It protects us against pathogens, against infection, and also protects us when there's trauma or damage to our tissues or our skin. When we look at inflammation in the steps, the first thing is there has to be detection of some sort of trauma. So this can be cells that are damaged by an infection, like by pathogens, or by physical injury, like you hit your arm. So when this happens, receptors on our cells will recognize the damaged cells or the pathogens and start inflammation. Once the cells detect that there is some sort of damage or there's a pathogen present, they'll release pro-inflammatory mediators. This includes histamines, prostaglandins, and cytokines, which are just chemical signals. These cause our blood vessels to dilate, means they become bigger, so that more white blood cells can go and reach the site of damage. Another thing that happens is as our blood cells dilate, blood flow goes to the affected area, and this is good because our blood has white blood cells and this can help with healing. We also see redness and warmth. So the increased permeability allows our immune cells like neutrophils and macrophages to pass through the walls of the blood vessels and enter the affected tissue. Chemokines, which are a type of cytokine, guide cells to the area of inflammation. Once this happens, white blood cells like neutrophils and macrophages will eat up and destroy pathogens like bacteria, and this is called phagocytosis. Macrophages also help clean up the site by eating up dead cells. Once this is done, you want to resolve inflammation. So once the pathogens like the bacteria are cleared up and or the damaged tissue is repaired, the inflammatory process has to end. So anti-inflammatory mechanisms kick in, and this is important so that healing and tissue repair can happen. Now, in chronic inflammation, if the cause of inflammation doesn't go away, or if our immune response is not working properly, like someone has an autoimmune disease, inflammation can persist and this can become chronic. This sustained inflammation can lead to tissue damage and can contribute to the development of chronic diseases. So a little bit of inflammation is good, too much is bad. Signs of inflammation are redness, which are caused by vasodilation, meaning blood vessels getting bigger. There's heat, and this comes from increased blood flow to the affected area. There's swelling or edema, and this because fluid accumulates due to the increased permeability of the blood vessels. There's pain. Pain can be caused by pressure due to nerves from the swelling, and then there can also be loss of function at that area, serving as a protective mechanism so you can heal.